Okay, so welcome back. This week we're revisiting Dr. Hannah, and we're talking about pelvic lengthening. We're talking about specifically about the pelvic floor, this area between the sits bones. So if you're looking up at the pelvis from below, we have the ilium on both sides. We have the tailbone right here. So there's your sacroiliac joint on both sides, and this network of muscles and connective tissue. As we're looking up at the bottom of the pelvis, this is your pelvic floor. This is an area where there can be tailbone pressure, there can be tailbone pain, pressure on the pelvic floor. Poor posture can lead to pain in this area. Stress can tighten all of these connective tissues in addition to glute max on both sides, gluteus medius, even some of the lumbar spine muscles that come all the way down to the tailbone. You can have pain with sitting. If your glute max, if your butt muscles feel tight all the time, any of this can cause significant discomfort in this area. So if some of these muscles, if some of these symptoms sound like it hits home with you, these are all cases in which learning to lengthen and relax your pelvic floor can definitely help. So when we look at the anatomy around the tailbone, there are various muscles and connective tissues that attach both sides, attach the front to the back, and so this network can become very tight. And if it becomes chronically tight and dysfunctional, it can become painful, certainly over time. So as you can see, looking at that tight network of muscles, this can literally become a pain in the butt, actually. So that's why learning to lengthen and relax this area can be of great significance, can be a great tool to help alleviate your discomfort. So many of you know this exercise. Let's get right into it. This is child's pose. So Dr. Hannah is going to get down on both knees, widen the knees, at least shoulder width, probably a little bit wider than shoulder width. And so in this position here, you can see she's sitting back as far as she can on those heels, if possible. If that's not possible, that's fine. If you're having pain in the knee, pain in the hips, you don't have to go back quite so far. Lengthen those shoulders out as much as you can, get that chest as low as you can. And now in this position, you're simply going to breathe. So long, slow, silent inhale through the nose. As you inhale, that diaphragm, your thoracic diaphragm, is going to descend. It's going to lower, and as it descends, it's literally going to push on your guts. It's going to move your organs down toward your pelvic floor. So if we're relaxed back here, if we can learn to relax, create a little bit of mind-body awareness here, learn to relax, that diaphragmatic breath will push your viscera, your organs toward the pelvic floor, and you'll begin to feel your sits bones spread apart. Bring some awareness there. Notice your sits bones spreading apart. Notice that pelvic floor expanding and relaxing. So let's take a look at this from another angle. Okay, so same exercise, a little bit from the side. So Dr. Hannah is going to get down there, and you can see just how wide she brings those knees. So opening up the hips, opening up the pelvic floor, focus on relaxing, bringing that mind-body awareness to the pelvic floor. Breathing, long, slow diaphragmatic breath in through the nose. Feel that diaphragm descend, feel that pressure kind of descend toward the pelvic floor. Notice the relaxation back there. Notice that spreading apart of the sits bones in this position. Now we'll take a look at this a little bit differently and create one more option for you. So with this slight modification, Dr. Hannah is just going to grab this pillow, bring it around, and fold herself. She's going to fold her hips over the front of this pillow. What's happening here is the pillow is creating some very slight anterior compression of the abdominals. So when we talk about those guts, when we talk about your organs being compressed, or when you breathe in and your organs get kind of pressed down toward that pelvic floor, we're creating a little bit more pressure anteriorly. Using this pillow, breathing in, you should feel even more pressure across your belly, across your chest, and that will make your diaphragmatic breath more effective in pressing down on your organs and creating a little bit more space, a little bit more expansion through that pelvic floor. And once again, as you become more aware, as you begin to develop some more mind-body awareness, you'll notice those sits bones spreading even further. You'll notice more relaxation in the pelvic floor. Once again, breathe in through your nose, fill your belly with air. While you do this, feel the space between those sits bones expand. Exhale, let everything out, let it relax down. In any of these variations, you'll want to stay here for about 2 to 3 minutes. You might want to do this several times a day. Of course, the more frequently you get to this, the better. The nice thing about this is that the more frequently you get to this throughout the day, the more the body resets, the more comfortable you become in these positions, creating more mind-body awareness, more relaxation, and the progress speeds up even more quickly. So I hope that was helpful. If you have any more questions, I know that Dr. Hannah would love for you to reach out and talk to her more about this, talk about more variations or other options that you can do to help begin to find some relief and relaxation in these areas. Thanks so much for watching, and we will see you here again next week.